Welcome back to the Well Necessity podcast, a podcast and soon-to-be documentary film dedicated to men's mental health and men's suicide prevention in honor of my older brother, Andy, who I love very, very much. I am Sophia, and I am the executive producer of Well Necessity because your wellness is a necessity. We are a team of creatives, visionaries, therapists, and humans with very big hearts who have come together to join forces for one shared goal: to create a culture that lets men know it's okay to ask for help, and to deliver a powerful message to you on this podcast of motivation, inspiration, and to share real-life, relatable stories from men who have overcome darkness in their lives, as well as therapeutic techniques, tools, and resources from our expert guests to support you on your journey. On today's episode, I have two very special guests, Anthony Gonzalez and Dr. Michelle Weiner, who I admire so much. They have dedicated their life to mental health and are real life superheroes. Anthony Gonzalez, he is our lead consultant on the documentary film project. He is a licensed clinical social worker, and he's also a qualified supervisor with over 15 years of experience. He was trained in MAPS protocols for PTSD. He is also trained in EMDR level 2 in dialectic behavioral therapy for prolonged exposure protocols. And we're so grateful for him being here.
Thank you. Very happy to be here.
And our other very special guest, Dr. Michelle Weiner. Dr. Michelle Weiner is double board certified in interventional pain management, physical medicine, and rehabilitation. Dr. Michelle is also known as South Florida's medical cannabis and ketamine-assisted psychotherapy expert and educator. Dr. Weiner was trained in ketamine-assisted psychotherapy by the Ketamine Training Center and incorporates a multidisciplinary patient-centered approach. Thank you so much for joining us here today.
Thank you for having me.
So I would like to start by learning a little bit more about ketamine and how it has impacted your patients. If you have a testimonial that you would like to share.
Sure. So I actually saw one of my favorite patients last week in the office, and he was one of the first patients I ever did ketamine-assisted psychotherapy on. He's probably around 40 years old and was a paramedic, and he injured his ankle while he was not working, but it actually caused him to not be able to work. And because of his chronic pain, he ended up developing severe depression. And his depression really caused him to be in a loop of thought processes based on the fact that he felt very hopeless. And he went into thinking, he was going to be a successful, strong, wonderful male in this field, and in the end he wasn't able to take care of other people. And so it really played into how he felt about himself as a man, and he wasn't able to be loving in his relationship or even be able to be a good son to his parents because he felt like the world was really against him and he felt very hopeless. And so he started working with myself and our integrative mental health therapist, and we really started putting, a plan in place, because when we're working with someone doing ketamine-assisted psychotherapy, we do a very thorough biopsychosocial assessment, which basically means what's going on with the person biochemistry in terms of their actual physiology and their medical medications and different medical conditions, but also psychologically, the thoughts that they're thinking, and socially, who's in their environment, and culturally, all of those aspects really play into how we're going to treat the person. So he ended up having this belief about himself that he just wasn't good enough, which really stemmed from a very young age. And then when he wasn't able to continue to work as a paramedic, he had this thought process again that he's not good enough, and so he wasn't really able to be the man he wanted to be. And so ketamine is really a catalyst to open up people's minds and really get them in touch with the mind-body connection. And so he wasn't physically able to do certain things, which then didn't allow him to mentally believe like he was a strong, powerful male. So what we did initially was just allow him to connect with himself and just to understand who he truly is, the essence of who he is and why he actually was limiting himself by believing that he wasn't good enough, and where this came from in terms of his upbringing and attachment styles and all of that. And so ketamine was really, like what we say, a lubricant to open him up to believing that he can be productive and have a good quality of life. And so because ketamine's a dissociative anesthetic, he actually was able to have pain relief, but also able to reprocess some of the traumas that he had been through. And so we did 6 sessions of ketamine through intramuscular route of administration. We actually did it once a week over 6 weeks because you generally need a few sessions to create neuroplasticity, which is this new pathway that the brain is going to be taking by opening up the certain receptors and then creating a little bit of motivation to change. And so he would work with me doing the intramuscular ketamine and then work with the therapist in between the ketamine sessions. And he really is just a completely different person today because he was able to realize that he wasn't a victim, and he was very much in that victim mindset, but also has quality of life now because he's able to understand that he has different sensations in the body, and they're also associated with different emotional experiences. And when he's able to track that he has pain in his ankle, for example, but that doesn't mean that he is limited from the rest of his life or hopeless, then he's able to reframe what's actually happening. So now he plays basketball, and he's in a very loving relationship, and really he lost 30 pounds. I mean, completely different male because he has different ways of thinking about himself, and he has hope. And a lot of what we're doing is just giving people hope that certain medications are not as effective, and the medical model is actually hurting a lot of people because we're putting people into these boxes to give them a diagnosis, and a lot of times their lifestyle is not really helping what's going on. So it's really a very personalized approach, and he was a very meaningful patient in my life because he was one of the first people I ever treated, and he had multiple traumas and chronic pain and was able to really move forward in his life to have some type of quality of life now, and really just have a different way of looking at his own life, and also now participating in society and with his family. So it was a real 180.
That's beautiful.
That's so
Thank you
beautiful.
so much
Yeah.
for sharing. I love that story and how ketamine can allow you to find who you truly are underneath the stories that we tell ourselves.
Right.
And when you mention ketamine as a dissociative anesthetic, can you describe what exactly ketamine is and what about it is dissociative? Like, what is the experience like if I or anyone listening was to take ketamine?
Sure. So ketamine blocks the NMDA receptor, which is a receptor responsible for neuroplasticity. And that means that it increases glutamate, which is an excitatory neurotransmitter, allowing the person to have a brief period of time where they're able to analyze their life from a new perspective. And it allows them to kind of take a time out or create a space where they're able to step back, and it almost separates their mind and their body. So if they're in a thought process of, I'm not good enough or I'm not loved, then they're able to actually create a space to step back and realize this is actually not happening to me, but I actually can have some control over what's happening. And the dissociation is a very interesting feeling to a lot of people, because it essentially feels like their ego or like their conscious mind is not in the forefront of their decisions. And at the same time, they also have pain relief in their body. It's an anesthetic, so they're not really able to feel what's going on in their body. And again, this is very dose dependent, but it does help to separate their thought processes. So if they are consumed with the fact that they're depressed or they're anxious or they have chronic pain and this becomes their identity, they're able to really observe or be the witness to what's actually happening in that situation, and it helps them reprocess what's really actually happening in their reality. So that a lot of preparation goes into it and integration to make a long-term change, but the dissociation is really a very interesting experience to help people make meaning in their life and to find who they truly are underneath all the stories they've been telling themselves. And so there's a part of the brain called the default mode that's quiet, and the default mode is really what holds our ego and our personal narrative of who we are. And so if that is less active during a ketamine or psychedelic experience, it allows us to create different opportunities so that we can move forward with a different way of thinking and feeling, and hopefully our behaviors will follow.
I'm glad you mentioned that, because as you were talking, what was going through my mind was like, okay, what is the mechanism of change that happens with all these things happening? And you mentioned the default mode network, and I'm curious, in your experience, or is that what is ultimately the differentiation in longer term, that kind of how we see ourselves changes on a neurological level also?
Yeah, I think psychedelics and ketamine is such an interesting field, and it's really in its infancy in terms of what we know about the mechanisms. And a lot of neuroscience and functional MRIs are teaching us more now than just based on specific neurotransmitters. And even with ketamine, it can increase glutamate. It works on opioid receptors as well as serotonin and dopamine. So it has a variety of different mechanisms. So the question really is, why is that person getting better, right? Is it because they have this surge of glutamate where they're more motivated to make change and then look at their life in a way where their story of who they are isn't at the forefront? Or is it the fact that they had this dissociative experience where they were less entrenched in their traumas and their anxieties and able to kind of zoom out and change the lens? It's hard to say. And there's also an increase in something called BDNF, or brain-derived neurotropic factor, which is a protein that creates neuroplasticity. So what I actually believe is that, it could be a combination of different things. It could be what's going on psychologically in terms of the actual session and the insight gained. It could be a functional mechanism based on neuroplasticity, or it could be an increase in these neurotransmitters. And it's really educating the patient as much as possible, because if they believe that it's just a medicine, then they're less likely to take action and change their behaviors, because essentially then they're just passively coming in to get the medicine and really not preparing for the session and not gaining as much from it. And usually once they're starting ketamine, they do a few sessions in a row, because it does have a short half-life, so you have to continuously feed the new pathway, but you also need to steer it in the right direction by being with people who are open and positive and sleeping well and exercising and eating right. So it's a combination of different things, but I feel like the more we prepare someone, the more likely they are to be open to the different potential mechanisms and then have a little bit more autonomy over their sessions.
I think what's really interesting is this concept of neuroplasticity, because I think that some of us feel stuck, and when we have these beliefs about ourselves, that becomes our identity.
Right.
And I think this concept of being able to grow, adapt, and change and create these new neural pathways in our mind to really change the narrative of who we are is very powerful for someone who's been struggling with depression for so long. And I also recently heard of the BNF, the brain food, as
fertilizer.
Yeah, the fertilizer for the brain. As,
Right.
I'm quoting from Therapy in a Nutshell. So yeah, super amazing stuff for all the science nerds out there. And if you could share, what is it about ketamine that is so beneficial for someone who is struggling with chronic resistant depression?
Treatment-resistant depression.
Treatment-resistant
Yes.
depression.
Right.
And he's someone who has thoughts of acute suicide ideation as well.
Ketamine is actually a rapid antidepressant. I mean, if there's anything that it can do, it can, decrease suicidal ideations very quickly. So one of the benefits with ketamine over, let's say, SSRIs or serotonin medications is it works quickly. A lot of the other medications take weeks for it to actually work properly. Both are better off with therapy, though, so that we definitely know. So because ketamine, it does, activate serotonin, but it's not the main driver. People who have depression, or at least treatment-resistant depression, in order to qualify for that diagnosis, you have to try and fail different medications, which means that they've already probably gone through the route of trying different SSRIs or tricyclic antidepressants, and those are all boosting serotonin, which may be effective in the short term, but people were not supposed to stay on antidepressants for their whole life. So now it's created this concept that serotonin is the molecule for happiness, right? And people who have depression, it's because they have a chemical imbalance, which first of all is then implying that something's wrong with that person. You know, you're giving them this diagnosis of depression, and maybe they're just feeling sad, or it's a vulnerable time in their life. And, you know, when they go to the physicians are very much in this model of give the person a diagnosis so you can give them a medication, as opposed to listening to, you know, why they're feeling sad at that moment or what has changed in their life. And what I've seen is that for the most part, people are chronically stressed and not maintaining what we call a good body budget. And also they've had trauma that they're really not paying attention to because it wasn't as traumatic as, let's say, a rape or being in war. And so they're not really taking, ownership over the fact that they've had trauma in the past. And so chronic stress creates a lot of inflammation in the body, and it also doesn't allow for neurons to connect the same way. And so now we have people who are chronically stressed or have unprocessed trauma that's living in their body that creates this feeling of depression. And that's why we have treatment-resistant depression as a diagnosis for using ketamine. Really, it works on a completely different mechanism, but at the same time, the goal is to get people off of medications and really get to the root of why they either have had some type of trauma and how to heal from that trauma, or how to help them cope with the fact that we're all living in a very stressful environment and that's not changing. So how do we increase our resilience to stress? And that's really what we're trying to teach people, because it doesn't seem like stress is going to, change anytime soon. It's just more our response to stress has to change.
Absolutely. I remember being at the Psychedelic Science Conference last year, and during one of the presentations, he had this graphic up, and it said, meditation is medicine, laughter is medicine, community is medicine, sleep is medicine.
Right.
And I was like, while those things don't correct or completely fix somebody who maybe does struggle with some biochemical elements of depression, I don't think we can fully get better without those things, which is
Right.
what you were just saying. It's
Right.
like we have to look at that whole body, whole person and environment perspective if we're going to really help people that are struggling with things like suicide ideation or chronic treatment-resistant depression.
I agree. I mean, if people don't have some type of mindful practice, or they're not checking in throughout the day, how am I feeling? Where is this in my body coming from? And also, how am I sleeping? And what am I eating? And who am I talking to? And, all of those things are really important. That, again, when someone's doing ketamine-assisted therapy, we're teaching them a practice so that they're not needing the medication long term, but really getting to have a better relationship with themselves. And they have to, a lot of times trauma disconnects the mind and the body, and so you really need to allow them to connect with themselves or with others. We even do ketamine in groups so that it helps people witness others in a compassionate way, so that they're able to have some self-love and some, gratitude and forgiveness for things that have happened to them as they witness it with other people. So it's definitely a mind-body medication, but the way that it will work in a long-term fashion is by allowing them to have a mindfulness-based practice. And that's like the core of it all. So it's not just a medication, it's not just therapy, but it's actually giving them the awareness of where these sensations are coming from and then able to move through them.
And you mentioned when we had spoke that you create an individualized plan for your patients and you take more of a holistic approach, but holistic in terms of the whole person. Can you share more about that?
Yeah. So when I like, there's a book called How Emotions Are Made by Lisa Barrett, and she talks a lot about the body budget. And the body budget is like, our lifestyle, basically. And so if someone is coming to me, I have to know a lot about them, not just about their upbringing and their coping skills, but also what they're doing day to day. Are they going home to someone who is traumatizing them even more, or are they making poor choices with their food or with their sleep, and what are their goals in life? There's a lot that we really have to know. I match them up with the right coach, facilitator, or therapist who's able to help them based on what they need. Maybe they need a breathwork practice to help calm their nervous system, or maybe they need ideas for how to exercise, not just the medication, right? So we personalize the entire ketamine-assisted psychotherapy, and also sometimes it requires maintenance. So it's really looking at the whole person to understand who they are, and then for them to understand that a lot of what they're believing about themselves is just a thought that may not even really be true, that we're able to reprocess with them. But if you don't optimize the lifestyle, the medication is only going to be a short temporary relief.
I love that. You have to see all of the factors that can work through battling through depression. And how would you determine if someone is a good candidate for ketamine, and who would not benefit from ketamine?
Preparation is huge. You know, it's really educating the person what they're about to experience, and also understanding that they, you know, if they have high blood pressure, we have to make sure that that's controlled. Obviously, they can't be pregnant. People who've had a history of schizophrenia, psychosis, or even mania sometimes are not candidates for it, because there's a lot of chemical changes that are happening in the brain, and at the same time, they're also potentially reliving certain memories. And, you know, there's like a critical period of time that the ketamine's going to work for that kind of, you know, allows them to become open to reprocessing what has happened in the past. But the preparation is really important for them so that they're able to feel safe and let go into the experience. If I'm giving someone ketamine, they need to trust me, and I have to have a relationship with them so that they're able to let go. If they're resisting the experience, then they're basically in their conscious mind, and what we want is things that are really suppressed in their subconscious to come up, for them to get these emotions out of their body, and to then understand that at the moment maybe they're feeling anxious or maybe they're feeling depressed, but this is just an emotion, and where is this feeling coming from, and how can we move past this? Meaning, how can they sit in their discomfort without needing to either medicate or, you know, and also to have a better understanding of where it came from, because a lot of these thoughts are thoughts that were created and now become who we are, and we can change that. And that's really what neuroplasticity is. We can learn something different, and we can realize that we have maladaptive behaviors, and then we can unlearn them and choose something else.
Yeah, absolutely. And just along those lines, as you were saying, that where my mind started to go is like, okay, there's so much preparation work that goes in, and not even just from an assessment point. So I'm thinking, as a therapist, like, when would be a good time to refer? Is that somebody that maybe they've done some baseline work of coping skills and grounding skills, and then it's a good time? Or is that something that if they were to come to you, that you would, in your office or in another, you know, a good, effective treatment center, ketamine treatment office, that's the work that would be, the groundwork would be laid before the treatments start?
Ideally, I would want them to meet with a therapist or coach prior to having ketamine, at least a few sessions, not just to know them well, but then to help them understand in that moment, you know, can they connect with their breath and help to calm them down so they can deepen their ketamine session, or well, what are they going to do when they go home, or what do they have planned for the next few days while the ketamine is really used as a primer in that situation. So ideally, it's good if they have worked with a therapist. However, there's all different, you know, there's internal family systems, right? There's DBT, CBT, so there's so many different ways that therapists are working with patients, but really, what is going to get that person to connect with who they truly are and kind of break down all the stories that they've created about themselves and done it just to protect themselves, you know? And so it's really who are they going to feel comfortable with? Sometimes a person needs a ketamine first just to kind of start the process, because they're, you know, so depressed, not able to get out of bed, not really being very productive in therapy, and very frustrated and hopeless. So sometimes the medication is almost this catalyst to say, okay, I have a little bit of hope that, you know, the ball starts rolling, and now I'm going to continue. And other people need therapy and more coaching in between their ketamine sessions to really integrate some sessions that may be very powerful.
Yeah.
Interesting. And how would you say ketamine differs from SSRIs?
Yes, very different. Well, ketamine mainly is increasing glutamate, which is this excitatory neurotransmitter, but it's also something used a few times to allow the person to reprocess different traumas and kind of increase their motivation to change, as opposed to SSRIs are really increasing the overall amount of serotonin in the body, and it's taken on a daily basis, and over time, if there's more serotonin, it causes the receptors to not be available in such a way that then you are having a blunted response to a lot of different things in your life. And really what that means is this emotional numbing. People who are on SSRIs for years, they can't really have the same type of response to a specific event experience in their life because of biochemical change in their body. So it's the same thing like opioids. People who are on chronic opioids obviously make less endogenous opioids, which are endorphins. And so then they're not able to feel happiness and pleasure as much because their body isn't producing it. So the goal is to let our body do what it's supposed to do, to self-correct and self-heal. And that all comes from just staying in balance. So sometimes when you're able to get someone to feel that flow where they feel like mind, body, and soul is all really connected, then it gives them a lot of hope that they're able to have that, access to themselves in that way, as opposed to just relying on a medication so that you don't become too sad or too happy or too anxious. But really what we want people to do is feel their feelings and then choose lifestyle choices that are going to complement that.
I think about some of the people that I've worked with that have experienced ketamine treatments, and I think that is such a key point. It's like they're almost developing different relationships to their emotions versus avoidance, or I don't want to feel angry, I don't want to feel sad, I don't want to feel afraid. It's like, no, I can allow these and try to understand them more. And oftentimes they come to that deeper awareness through the ketamine treatment process.
Right.
And I think you can get there with kind of more traditional therapies, but it just takes a lot longer
Yeah.
for many people. So,
no, it's true.
yeah.
I mean, I think that we are now in the state where we have like 1 billion people globally that have some type of mental health condition, or I think it's 20 million that are in chronic pain, 30 million Americans that are depressed. So the stats are incredible. So then it really helps us take a look at the fact that what we're doing from a medical society is not working. Just giving someone a medication to blunt their emotions so that they can continue living their life, instead of like picking up the rug and sweeping out whatever is under there and really getting to like the seed or the core of what is creating so much disease in their body.
I just wonder if I
And
can add
mind.
real quick to that, because I agree, and I was even thinking as you were talking was, like you mentioned a while ago the stories we tell themselves, and I think so many people, especially people that I work with, they don't even recognize they believe a story that was told to them,
Right.
and they don't even see the power that they have in the ability to shift it, because they just accept this is what I am.
Right. And I think that's the beauty of ketamine and psychedelics. If you're willing to actually participate in the psychological insight, then it allows you to really step back and say, where did this story come from? And like, maybe I just learned this as a child, but now I'm older and I actually can take a look at this thought and say, this isn't really my belief. This is a belief that was just kind of given to me, and what do I actually believe in? I think that then people have to deal with how they judge themselves, and being open to looking at the fact that maybe they are willing to change a belief about themselves. And I think that could be difficult because people are always, that's ego, right? They're always trying to, not show weakness, I guess. And so it is a process. Like, a lot of different things come up that it's not just we take ketamine and everybody's happy for, a few weeks in a row. There's some things that really do, cause a lot of traumatic emotions, and they actually have to be worked through properly in order to remove them from the body, and also to have people analyze where they got these beliefs from. And also sometimes feelings are just feelings, and it's okay. We can feel that, and it could be uncomfortable, and we don't have to say that we have depression, And then those who are really suffering, ketamine could be a very quick way of separating yourself from those thoughts and realizing that there could potentially be hope.
Yeah, I mean, I think for people who are chronically depressed and have been suffering most of their life, it's really hard to believe that there is a different identity.
Right.
Like, I've heard this notion of my familiar hell is more comfortable than my unfamiliar heaven.
Right.
And I think, in talk therapy, I would be able to deflect or avoid. I can, small talk with my therapist and decide to talk about my relationship problems that day. But in ketamine, it seems like I'm not able to put up my defense mechanisms anymore, and I'm confronted by all of the skeletons in my closet.
Right.
So in what ways do you support someone who really wants to duck and run from all of their emotions?
Yeah, no, it's true. That's a good point, because there's a lot of people who want to control everything, and there's a lot of people who fear.
Hello, my name is Sophia. Been running from my emotions all my life.
Like the uncertainty is so much more scary for people than. And that's why they'll choose to live in the feelings that they know, which are really uncomfortable, but the uncertainty is more scary. And so I think, like, I talk about like a false fire alarm. People have a nervous system, and a lot of times they're thinking as if like there is really a threat when there really isn't. And it's how to recalibrate our nervous system to understand that we're just constantly being thrown different things that may be stressful, but it doesn't mean that we're in any danger. And I think a lot of it is how we talk to ourselves, and then being able to track different feelings in the body and understand, okay, this is coming from somewhere, and I'm not in any danger right now. There's no lion running, and then how to calm the nervous system on a more regular basis so that they're able to stay at this level. And I think a lot of it is really inducing that parasympathetic tone. Like, how can we get people to let go a little bit from their beliefs? And that's actually one of the main mechanisms of psychedelics. It's called the Rebus model, which stands for relaxed beliefs under psychedelics. And it basically means that when you give someone a medicine, the internal networks are less active within themselves, and then it allows for other parts of the brain to connect and communicate to give you a different perspective on something. So there's a lot of neuroscience in just creating almost this entropic hot state where the brain is really very active to learning new things and getting out of its old defaults. And a lot of that is helpful for people who do feel like they need to control things, because the fear of the uncertainty is greater. And what we have to do is create a safe place for the person within themselves. And, that usually stems from feeling safe with us, like the therapeutic alliance, the doctor, the therapist, but also having some social support so that we know that they can actually have someone else who just loves them or is able to be there for them. And then this way they can start loving themselves and having that relationship with them. So it's really a very like all-encompassing, life-changing experience when someone does ketamine-assisted psychotherapy, if they're doing it properly, and it always should be accompanied with therapy and integration.
Yeah, if I can add to that, just I think the therapy integration component is so important because of what you just said. If you're somebody who has spent a lifetime avoiding, right, or understandably compartmentalizing because those emotions can be so overwhelming, particularly depending upon where they're rooted, that if that all comes up now, what do I do with it? It's because it's not always, in my experience, and I'm you've seen a lot more of this, but my experience says it's not always comfortable. We get a new perspective, but maybe it's a perspective we're looking at things that are hard to look at, or we're revisiting experiences that are hard to revisit, and emotions that we didn't want to feel, but now we're feeling them. And that's, I think, that, which is wonderful, because that's the way we ultimately recalibrate,
right,
and get back to that kind of healthy equilibrium that our body wants to be at. But I think that's where the integrative therapy becomes so essential to the process. It's like, what do I do with all this material now that's been either I wasn't aware of or I was intentionally pushing away, and now it's all up at the surface.
Right.
What can I do with all of this now?
Yeah. And we all, I think, just want to get to feeling good and happy.
We all just want to get to feeling good, but it's not always a direct line. You
Right.
know? Yeah.
Well, and also we have gotten so used to just taking a medicine when we feel any type of sensation that is not the sensation we want at that time, or any type of emotion. Like people just medicate with something. If you teach someone a good mindfulness or breath work practice, then they're able to connect with their breath in that moment. Or, moving their body, like just checking in throughout the day, see if you need to move, see if you need to breathe properly, see if you need to change your environment. A lot of times people are just in an environment that is not conducive for them to thrive in, and then understanding what that looks like as opposed to trying to get better in an environment that is traumatizing them. So it's how much like the person can actually do, and then we can help them the more we know about their life and about their strengths, and kind of build on that to improve their overall resilience.
And for people who work in positions like our community helpers, our firefighters, our policemen, our veterans who are constantly in the state of chronic stress, is this why ketamine is so beneficial, like for veterans, for example?
Yeah, that's a good point. I do have a lot of patients that are first responders, and it's tough because they're living with a hypersensitive nervous system all the time. Like they're kind of in that fight or flight all the time. And then we're asking them to turn that off so that they could be with us in regular life, right? And it doesn't work that well. It's not like you can't just shut it on, shut it off. So it's really helping the people, even when they're in that fight or flight, to realize what are the tools that I have to kind of calm my nervous system, or where is this really coming from? And the whole recalibration of the nervous system is really, that's neuroplasticity. You're really just creating change by learning who you are and what you want instead. And I think the problem is a lot of people know what they don't want, but they don't know what they want instead. So that's really what the coaching and therapy is about, is the visualization of who, the adult version of you can be. And sometimes it means you have to do the infancy trauma, and you have to go to those, deep wounds and then work through it. But if you don't, you may not really get to the core of why you're feeling the way you are. So I think like every person's a little bit different. It has to be the right time and the right partnership with the clinicians. But, it is a very different way of approaching trauma and chronic stress.
And would you be able to talk to us about the intention setting and integration process with ketamine?
Sure. Generally, we'll find certain beliefs that people have about themselves that limit them. Obviously, we do a very thorough biopsychosocial assessment, but then we're looking for thoughts that are kind of in their default of maybe feeling powerless, or feeling like they were not lovable. So we're really like understanding what their hardware is telling them, so that then we can try to help them look on the other side of that, which is really, a lot about their fears. Like, what would it mean to feel powerful, or how would that feel to be loved, right? And a lot of times, or just feeling peace. A lot of people are just going constantly, and they're more comfortable in that fast pace because they're not really feeling their feelings. Like I have a lot of like very successful older men who are now my ketamine assisted therapy patients because they worked for many years, have a successful business, have, very healthy, loving family, but they're completely disconnected from any emotion because they just worked and their goal was just to be successful, and that's how they measured success. And now they don't have any type of actual emotional connection to the experiences that they're going through with their family, or maybe their business is really great, but they don't really feel connected to it. So a lot of the work that we're doing is really helping them understand they've been living a certain way for a long time. Now, can we get them to slow down and really connect with themselves so that they understand what happiness is really going to be for them at this point in their life? And sometimes that changes as we age. I had a woman who was probably like 65 years old, and she just had so many episodes of depression all throughout her life, treated with so many different medications, multiple different therapists, and really like the ketamine session just kind of shifted her in a way that nothing else could have done that, or maybe a different psychedelic, but it really just gave her this distance to realize these thoughts are her own thoughts, that she really is like, running on old programs. And then when she was able to have her ketamine experience, she realized she was just really getting very anxious about getting older. And the fact that she wasn't going to be as capable or as strong, and that really was not something that was in her conscious mind, but kind of like came up during this experience. It was more of a fear of getting older, and how maybe she's not going to have the same capacity as she gets older to, be the mother of her family and all of that. So that's really understanding where these fears are coming from. Sometimes they don't really know. They're just kind of in this like uncertain, uncomfortable place, but they don't really understand the source of it.
Yeah. And that part of our mind just drives the behavior, can drive the behavior without even knowing. So
Right.
we just feel that anxiety, we feel that trepidation, and we feel that pullback or irritability or however it often shows up in our body. And then we label it as that without, and I love how you said that, because label needing to explore where it comes from and
Right.
where it's rooted and what belief or what attachment or what fear. Because when people can look at those things, then we have a chance to pivot, or we have a chance to see it differently. Some sort of, we have, I love how you said that it's an opportunity to feel some sense of power in that powerlessness that might be ever present for somebody.
Right, and they need that, because they need to know that they have control over their mind, right, and over their health, as opposed to, I just think we got too used to going to the doctor once we're sick and expecting them to fix us, as opposed to now, like our age, I think we're trying to look for ways of staying well and, looking into longevity, as opposed to the sick model. Right now it's like, how can we promote health and prevent disease? And most of it is lifestyle, and most of it's just paying attention to what our, how our mind and our body are connected, and how we can optimize our overall wellness.
So important. And on that note of optimizing our wellness, perhaps both of you could share how sleep, nutrition play a role into our overall well-being.
Sure. Yeah, I mean, I think that we have like an inflammation epidemic. I think that I think chronic stress, obviously increasing our cortisol levels, also playing into the overall amount of just the amount of external stimulation that we have is really affecting how we're perceiving the signals from our body to our brain. And so, most of our day is spent understanding the signals that are coming from our body to our brain, and from our brain back to our body. And that's interoception. That's understanding that we are safe. However, again, I feel like a lot of times people are misinterpreting these signals, and they're thinking that there is danger when there isn't danger. So generally, I think that decreasing overall inflammation, and also paying attention to our stress response, because we can't eliminate stress, and we need a certain amount of stress to keep us going, to keep us, challenging ourselves, and to keep us motivated. But in general, I think if we decrease inflammation, which generally will happen with getting good sleep, with having some type of exercise or moving your body in some way, definitely paying attention to what we're eating, and also having some type of spiritual practice, and a mindfulness practice, whether that's breath work, meditation. Sometimes it's hard for people to meditate when they are in a depressed or anxious state, because they don't like that voice in their head, and they don't want to connect to that voice in their head. So when it's quiet, they're listening to that voice that is guiding them in the wrong direction. So I generally think breath work is an easier way to start than meditation, but I also love physical exercise, and that can change. Like sometimes people need the high intensity, sometimes people love to run. Personally, I love to run because I love to be out in nature. I'll listen to podcasts, but it has to be personalized to like what is going to be beneficial to that person. It means they have to enjoy it. Like you have to actually do an exercise and enjoy that exercise. Otherwise, your brain is spying on your body, and and it knows, like you're not enjoying this, right? So it's important to connect the two, and I think nature even is a great way of just like a healthy environment to be in. So how can we decrease inflammation? I guess that's the bigger thing. And then also, how can we decrease medications that we're on, and look at our overall body metabolism? Like our brain is 20% of all of our energy, right? And it's 3 pounds. So we have like the rest of our body that if something's wrong, we need to, use our muscles for, or our heart and lungs, and as opposed to someone who's resting is metabolizing their food, for example, or being in a restful state. So it's being in connection with who you are, and also trying to get into the right, like we are the caretakers of each other's nervous systems, right? Like trying to understand like how your body performs well, and also just the energy of who you are. Like putting out that energy is really important, but you have to be connected to it.
Yeah, so beautifully said. I agree with everything, and I would take just a little bit different perspective that, because that's so true about inflammation. But even that, in the way I examine it is that our body doesn't want to be in a state of survival all the time.
Right.
And if we're struggling with sleep, if we're not sleeping well, then our brain is interpreting something is wrong. If we don't have some balanced nutrition where our body has the appropriate vitamins and minerals and that to function, then we're going to perceive something is wrong. If we're taking in too much caffeine and our heart rate is elevated, and then our brain is going to perceive it a little bit as wrong. Or if I love the breath work point too, because that's so true, that if we're not allowing for calm, we're not allowing our body to actually feel a sense of safety and recovery, then it's going to perceive something's wrong. And so if we're not actively, through exercise, working out the normal stresses of the day and keeping our natural balance of adrenaline and cortisol and these things helping kind of, because they're going to go up and then they need to come down. And then sleep, our body will want to regulate naturally when we get an appropriate amount of sleep. And that looks a little bit different for everybody. Some people it's on the 6 hours in, some people it's on 8 or 9 hours in. That's not a static for everybody, but if you're somebody that only gets 4 hours of sleep a night, we can reasonably predict what type of problems will come with that down the line. And so I think it's that, like the sleep, diet, what we put in our body, what we don't, the role of substances like alcohol and things like that contribute significantly to inflammation.
Right.
That if we're not paying attention to those, then our body is going, or our brain, that subconscious part of our brain is going to acknowledge something's not right here, and it will resist that, which we often experience as anxiety or depressed mood or irritability or short-temperedness, things like that.
Which then causes people to focus less, and then they have this diagnosis of ADHD, and it's like no more diagnoses, like it's really like even the research on depression. One of the main thoughts was that there's less connection between the neurons because people are in this stress state, and that's what inflammation can create. And the parts of the brain, like the prefrontal cortex, are the ones that are allowing people to focus and for attention and for learning. So if the part of the brain that basically is allowing someone to focus, what's important that I should focus on now? What do I need to give my attention to? And how can I learn that I am safe and that I'm able to learn different ways of behaving? If that part of the brain is not functioning because we're chronically stressed, or we're eating, bad diet, or we're not sleeping well enough, or we're taking certain medications that are blunting our emotions, then we're setting ourselves up for failure. And that's really what's happening now, is that we have to understand what's the mechanism of depression, and that it's not just this serotonin chemical imbalance, and it has to do with metabolism and genetics and epigenetics and our lifestyle and so many different factors.
Relationships.
That's
a big part of it too. Yes,
Yeah.
I mean, interrupt with that.
No.
Yeah.
And that's a great point, because
Yeah.
I like, how many patients do I have that are depressed, and then all of a sudden they meet someone, fall in love, and their depression goes
That
away,
goes
right? and it's not, and really they didn't, I mean, there's a lot of mirror work you do in relationships, and then relationships are very healing, and also that's why I think, ketamine shouldn't be done with someone just by themselves in their room, right? Like this has to be done
100%.
in relationship, and I think healing is very relational. I agree.
Well,
Yeah.
I was asking about the connectivity in the brain
Yeah.
and what we know about that, and you were explaining. If you want to go back over this part, explaining the GABA and
Right, there's a balance between glutamate and GABA, and that's really important so that people don't have too much glutamate activity or too little GABA, which basically means that the person's staying in homeostasis. So ketamine can increase glutamate very quickly for a very short period of time, but it actually does that on the GABA interneurons, which is kind of interesting. So it causes this spike of glutamate, but it doesn't continue for a long time. And that's why you have that critical period to work with the person for a few days after the ketamine session to really get in there and try to understand where their thoughts are coming from and how to change their behaviors based on that. But in terms of psychedelics, they've seen this global functional connectivity. So more networks are actually communicating, and there's less within the default mode. So there's less thinking about your suffering and thinking about your identity and being able to kind of zoom out in that way. But it's interesting because you can do it from a biochemical standpoint, but then you could also do it from a psychological and social support as well. So they're able to have these sessions and then come back and either have a lot of awe, basically, that they just had these experiences where they were connecting with something bigger than themselves, or they transcended time and space and they can't even put into words the type of feeling that they're experiencing, or they feel connected to themselves in a way that they haven't felt before. So it's sad to say one or the other, and a lot of people just kind of, like I like to capitalize on both. That's the way to make it work. And who knows, are they going to have these experiences and come back and have different purpose in their life because they had these experiences, or are they going to look at it like a medication because they're used to the old model of just medicating to kind of numb the feelings.
Yeah. And what I hear in that is that individuals can have really wide ranges of experiences and they can still be effective.
Right.
And then somebody can have more of a calming, deeply connected to sense of self, and it can be very profound, and somebody could have that very metaphysical,
Right.
transcendent experience, and it can be effective. And there's probably, I would imagine, room to make it meaningful, to have a meaningful, purposeful healing experience within those.
And sometimes they get
spectrum.
frustrated because they have certain expectations of meeting God or, flying in the sky, and then all of a sudden they see just one color, or they see something that looks like a video game, right? And then they start to say, well, is something wrong with me? Why am I not seeing all these visuals? And why is my mind not able to create this? So sometimes we do visualizations to help prepare them. And sometimes that's just how your mind works, right? And so it's not to judge it in that way. It's really to just be curious and see what comes up. And again, that starts with safety. Like the number one thing is just letting them feel safe so that they can really surrender into the experience and see what comes up, so that they can have answers that maybe wouldn't be able to get through, therapy, for example.
And that leads me to a question that I think we hear a lot about in this field is intention setting. And if you want to expand on that a little bit, because I think that's it's somewhat what you're talking about, of like kind of exploring what is it that I want to hope to get from this experience.
Right, and if you're just going blindly into a psychedelic experience without intention, then that to me is almost just recreational. You're just you're still exploring your mind in a certain way, but the intention is really setting you up for what do you want moving forward and how can you create that. And so sometimes, like, if they just want to feel calm, like they just want a quiet mind, or they want to feel calm within their body, then that's the intention. And if they're able to just listen to music and cover their eyes and have their experience and really connect with their breath, for example, in the experience, then and feel calm, then they know it gives them hope. They can access that. They can listen to their playlist, later on that day or the next day, and they can have a similar experience within their nervous system. But it's almost the zooming out that allows them to realize, I did feel that, and that was me, and I can access that. And most of the time it's really for most people, it's peace and love. They want this calm, and they want to feel love, and it's nice when they actually feel it. It's like a chemical induction of love, right? I mean, that's really the opposite of pain, and we want more love in people's hearts, but it's a give and receive type of thing. So they also have to, if they're receiving it, they also have to, give it to someone else. So I think it becomes like, especially in our community, we're trying to increase the love in people's lives, right? And true happiness, and it's really only going to happen with connection to self.
Yeah, I was just gonna say the people I work with, when they always talk about what is happiness, I say when you are able to accept yourself as you are.
Right.
Yeah, and then
And feel
without
aligned.
judgment. Yeah, that's right.
Yeah. And I think a lot of it is like just an awareness of who they are, and awareness that they're creating who they are. And if you are the writer of who you are, then you can choose to create something different. And that's the beauty of psychedelics, is you've been this way suffering for so long. Now perhaps there is something that allows you to have some hope that you can feel happiness. And what does that even feel like to you? You haven't felt happiness in years. So like when people say, oh, I lost the ability to have joy. That's a very common thing. Like, people come to me all the time. They're like, the things that used to be pleasurable to me are not pleasurable anymore, and I just can't feel joy. And it's like a phrase that I hear so often. It's like, well, I can't create joy in your life. Right. You have to tell me what once was enjoyable, and now how can we find things that in your life, because you're older or because you have a different type of social structure, like what can I help to have you participate in so that you do feel joy, which is breaking down what's going on in their day-to-day life. And a lot of times it's them limiting themselves. Like, they want to, participate in a social group, but they're too nervous to do it because they don't think they're smart enough, or they don't have enough experience, or they want to do exercise but they don't want to go to the gym because they're overweight. It's like they have all these potential ideas, but then they kind of limit themselves. So the support is really necessary during this process as well.
Yeah, we can really stand in our own way sometimes,
Right.
and
Yeah.
block ourselves from experiencing the fullness of our lives. And it sounds to me like ketamine is just this wonderful doorway where you can potentially experience this new reality of self. And I teach yoga, so when I'm done stretching, I always tell people, like, you never know what was underneath the tension inside of your body. You never know just how happy you could potentially feel, or how much calmer you could be in your body. And I know I haven't personally done ketamine, but from the stories you tell, I love the idea of redefining yourself. But I do want to hear about the experience, or not the experience, but oftentimes people feel that they need to have experienced a large trauma in their life in order to seek a therapist or to go to a ketamine doctor. Can you both share a little bit about the different types of trauma that one can experience, and how there are different genetic and environmental things that also can contribute to depression?
Sure. Yeah, so I think trauma could be developmental, or it could be something specific that happens for one incident. And I think that how the person judges trauma is based on their previous experiences and their predictions of a lot of things in their life. And so, what we're doing every day is making predictions, and our body and our brain, our nervous system's making predictions as to what's going to happen next to help prepare us. So I think that a lot of times people are raised in environments that they're just coping and living in, and they then become adults, and then they get to evaluate what's happening in their life now and how that's based on their attachment styles and different relationships from being younger. So I think that there's a lot of developmental trauma that people don't put a big capital T on, because even though multiple traumas over time will really create such change in the nervous system. And I think that seeing a coach or therapist sometimes helps reframe that, and really helping people understand you've been dealing with multiple traumas. based on the environment you were raised in, and you never really looked at that because you had to kind of protect yourself and keep moving on. And now you've developed into this person, but there's certain parts of you that don't have to be front and center anymore because you can take care of yourself. And it's really starting with them feeling safe within themselves. And so it doesn't have to be big T trauma always to use something like ketamine assisted therapy, but I do think it is a tool for people eventually in the right setting with preparation to get to their peak performance. And it's controversial because we're using this as a medication for treatment-resistant depression. However, I think that a lot of people are just stuck in old narratives, and sometimes a medication can help shift them in a way that will just expedite their healing. And so it's really a tool to make the process go a little faster, and also have them have this real salient experience that they'll remember, that kind of lives in their cells, that they'll understand the ketamine disconnected them from this thought process, and now they're able to recalibrate their system. And so it doesn't have to be big trauma, and I do feel like this can be some medicine for people who want to actually improve their overall wellness.
I can say that because that was my experience. Like, I mean, I've experienced traumas in my life, and over the past year when I have experienced psychedelics in a setting, that was really my experience. That it was just more opening. It really nothing came up about my past experiences. It was more about who I want to be, and get this much deeper, profound insight of who I want to be as a leader, as a clinician, as a family member, as a partner. All of that. And who I want, how I want to lead my life, and it gave me a much deeper access into those insights, and I don't think I would have gotten on my own.
Right.
And just want to circle back to the kind of, we're using these terms big T, little t, and for anybody that's listening may not know what we mean by that. Commonly, big T traumas are described as things that were life-threatening, whether it was violence or we fear our life may have been in danger. Physical harm was in play on some level. This could be child abuse, sexual assaults, and it can be direct and indirect to an extent of exposure to one of those events. Witnessing these things happen can often have the same effect as it actually happening to you. That's what we commonly talk about, big T traumas. And little T traumas, at least in my view, are that maybe our physical well-being wasn't at risk or having been harmed, but our sense of self was being harmed, our sense of identity, who we are, how the world sees us. Maybe you're being insulted or neglected or exploited as a child, and again, maybe not necessarily experiencing physical harm, but the damage is still there because your sense of self is completely fractured. And one thing we do know is that those actually, and I'm not comparing or judging traumas, that's not what I mean to say by this, is that those, what we call little T traumas, can actually be more intracted and actually be much more difficult to overcome through the therapeutic process, because it's not that this event happened and I'm trying to cope with, can I change how I see me? And that's why that is the area that I think where psychedelics, particularly ketamine and psilocybin, can be profoundly impactful in helping someone shift, because it does get deep into the parts of the central nervous system and the brain that hold those beliefs that are really difficult to access just through talk therapies, or even other bottom-up therapies like EMDR or prolonged exposure. They're really difficult to change that without 2, 3, 4 years of therapy.
A lot of times trauma is in a state where the person is relatively helpless, and then later on where they're talking to someone, realizing that these programs happen for these specific reasons, they're able to then take ownership and understand that they can make change. And I think that's the key, really to get the person engaged in a way that they're understanding what the intention is and where the beliefs came from, and the fact that we can just change our nervous system and we can learn something new, and what's the environment that person needs to be in to learn something new. And that's creating a lot of hope, because we don't have to be stuck in these programs. And we were raised in a certain environment doesn't mean we have to do the same thing for our kids and our family. And, you know, and I think that's like really true to being who we are, is like not judging ourselves and then understanding like the essence of who we are. That's our power. If we're able to understand who we are, then we're, you know, we have purpose, because we're really in our power.
I love that. That is the overall message that I really wanted to share with people, is that sense of you having control over your life, and you're not broken, you're not stuck. You have the power to change your reality. And, you know, I really want to also just to touch on people who have someone in their life, a family member or a friend who has struggled with chronic depression, and in what ways you recommend we can support this person. You can answer as well. So for someone who's never struggled themselves, but perhaps has said the notion of, you know, just start thinking positive. And what would you say to someone who believes this, and that attitude of, you know, we're all responsible for our own happiness, and you know, just suck it up type of attitude?
So I think first is always education. So like when someone is educated enough to understand the mechanism of depression, and they realize that it's not a chemical imbalance, then they realize they can take ownership over their health. And so if they think that their depression is related to poor coping skills from chronic stress, or they're able to identify beliefs that they have about themselves that are really from different traumatic experiences, then they can start to have a little bit of hope that the depression is something that can change. So I think education is one, and then empowering the person to take ownership over their lifestyle. And I think that sometimes people just need support. So it's knowing, you know, joining a gym, or joining a breath work, you know, or yoga studio or something like that, finding something where people are not isolated. And I think that if they're able to be with other people, then they're able to feel that support. They have a little compassion for themselves, and then they're starting to love themselves in a way that they've been missing. And it's like uncomfortable for them, because they've been in their head so much, you know, and now it's really trying to connect mind and body. And it's it's like we need all these functional MRIs to tell us that the mind and the body are connected, right. You know. And now that we know it, it's like, okay, let's just make sure we educate people so that everything is aligned. And sometimes it's really like a spiritual connection, you know, but it's trying to figure out what the person needs at that time in their life so that they can create meaning.
You're much kinder than me in your answer, because a part of me just wants to say, I just call bullshit when people make those judgments that like it should be easy. You're just get over it, or these types of things. And I don't think people really understand how harmful that is to place blame. I mean, it's this fascinating dialectic that we're having in this conversation, is that we don't want people to place blame on the individual while simultaneously saying, hey, you have more power than you realize, you know, and because both are true.
Yes.
And I think it's the plague of our society right now that we hold so much judgment on other people and their experiences without taking hardly any moments or time or effort to try to understand what life is like from their experience, from their point of view. What is it like to live in their skin, having gone, you know, traveled the roads that they've traveled? And so that's what I would say to anybody that is either hearing or saying, just get over it to somebody, or just get up. It's easy. Just go to the gym. Well, we know that's going to be helpful, but you're not. Take some time to understand why that might be so difficult for that person.
Right.
Because somebody that is crippled with social anxiety is not going to go into a gym with 200 people around that know what they're doing with the equipment. Because that person's going to walk in, or they're going to have a panic attack and they're going to get embarrassed and they're going to walk out. Or they're going to anticipate having a panic attack and walk out. Mm-hmm. They're not going to get there. So it's like, how do we help one another? And the closest thing we do is starting with our family, our friends, the people that we know may be struggling, not just say get over it. It's like, how can I help you? How can I sit with you? How can I start that process with you? Because if I know more about what it means, then I own a responsibility to help somebody who may not have that understanding. That's why it's so important you said that about education. And that doesn't just need to come from a doctor or a therapist. It can be like, let me be educated on what you're struggling with. Because somebody may feel stuck. Even though we logically know they're not, their feeling is important to know that it can feel overwhelming to feel stuck. And sometimes we just need to help people pull a little bit to get a little traction to not feel so stuck.
Yes.
Yeah.
And I love that you just validated everyone who has lived in that state where they feel trapped and they feel stuck, because I don't think that we can get to the next chapter unless we honor where we currently are at. And I feel that the most important part is when we have someone in our life who is depressed is just to have love and compassion for them. It's something very complex. And I know in the situation of my older brother, I didn't quite fully understand it. And my hope is with this episode is to educate and to inform everyone who is listening. So I thank you both so much for being here and taking your time. I hope everyone received something very powerful from this episode. If you feel that this episode was helpful, please share it with a friend. We encourage you to give us a like, comment, subscribe, and review on our Spotify episode. I will read all of the reviews. How about we end by both of you telling our audience where they can find you?
My website is drmichelleweiner.com, and my Instagram, LinkedIn is Dr. Michelle Weiner also. And I'm in South Florida in Boca, Miami Beach, and Hollywood.
You can find me at alereemotionalhealth.com, which is ALERE, emotionalhealth.com. Instagram is at hurt.heal.grow. And soon to be coming, a new project we'll be announcing called Blue Ocean Wellness that will be blueoceanwellness.com and at Blue Ocean Wellness on Instagram and all the other social medias. So
Follow them. They're amazing. Thank you.
Thank you.